Pneumonia is an inflammation of one or both lungs, typically due to a bacterial, viral, or fungal infection. With pneumonia, the tiny air sacs inside the lungs fill with fluids or pores. These can cause symptoms such as coughing, chest pain, and breathing difficulties. Anyone can develop pneumonia. The people most at risk of developing pneumonia are young children, older adults, and people with pre-existing medical conditions that weaken the immune system. The same groups of people are also at an increased risk of developing complications of pneumonia. Hello and welcome to the Spotlight. In today's episode of the program, we will be spotlighting the symptoms of pneumonia in adults and children and its causes, its diagnosis and treatment. We will also provide information on pneumonia risk factors, complications and prevention. Victor Wabery is my name. I'm not a doctor, but I'm only here to provide you with the necessary information that you need to live a healthy life. Welcome. But before we get into the conversation full-fledged, I'll go for a very quick break. When I come back, the conversation begins. Please do not stray. Welcome back. It's still the program, The Spotlight, and today the light is on the pneumonia disease. Let's start off with the symptoms. The first symptoms of pneumonia usually resembles those of a cold or flu. A person may then develop other symptoms which can vary depending on the type of pneumonia a person has. Common symptoms include: number 1, cough that may produce green, yellow, or even bloody phlegm. Number 2, fast breathing and shortness of breath. Number 3, chest pain that usually worsens when taking a deep breath. Number 4, fast heartbeat. Number 5, fever, sweating and chills. Number 6, fatigue. Number 7, confusion or delirium, especially in older adults. Number 8, loss of appetite. Number 9, nausea and vomiting. Let's get down now to the types. Pneumonia types differ depending on their cause. The different types and their associated causes may include: number 1, bacterial pneumonia. Now, when we talk about bacterial pneumonia, I need you to understand that many bacterial strains can cause pneumonia, but the most common is Streptococcus pneumonia. A doctor may refer to pneumonia resulting from this strain as Pneumococcal pneumonia. Number 2, viral pneumonia. Viral causes of pneumonia includes the respiratory syncytial virus and influenza types, which are A and B. Number 3, fungal pneumonia. These can result from a condition such as a valley fever caused by a coccidiosis in children. Number 5, aspiration pneumonia. This type occurs as a result of inhaling food, liquids, or stomach contents into the lungs. Aspiration pneumonia is not contagious. Number 6, hospital-acquired pneumonia. These can occur in people receiving hospital treatment for other conditions that involve use of a respirator or breathing machine. Regardless of the cause of pneumonia, the signs and symptoms will be similar. Now let's get down to pneumonia in children. In most cases, a child's immune system will protect them from developing pneumonia. If a child does develop pneumonia, it is usually due to a virus. Well, the symptoms in children may include: number 1, difficulty in breathing or breathing loudly. Number 2, feeding, not feeding as they usually do. Number 3, coughing. Number 4, fever. Number 5, irritability. And number 6, dehydration. Toddlers may complain of pain in their chest or stomach and vomit after coughing. But the treatment includes plenty of rest and a regular fluid intake. A doctor may suggest OTC medications to help ease symptoms such as abdominal problems or coughing, but these medicines will not help treat pneumonia. Adults should not smoke around children, especially if the child has pneumonia. Now let's get down to the causes of pneumonia. Pneumonia is typically due to infectious pathogens such as bacteria and viruses. These pathogens can spread via coughing and sneezing or by contaminating surfaces that people touch. In most cases, a person contracts pneumonia causing pathogens by breathing them into the small air sacs or alveoli within their lungs. The immune system responds by sending white blood cells to attack the infection, which triggers inflammation of the alveoli. The alveoli fill with fluid and pus, causing pneumonia. Let's get down to the risk factors of pneumonia. People most at risk of developing pneumonia are those who, number 1, are under 5 years old or over 65 years old. Number 2, people who have recently recovered from a cold or influenza infection. Number 3, people who have underlying conditions such as cystic fibrosis, chronic obstructive pulmonary disease, asthma, conditions that affect the kidneys, heart, or liver. Number 4, people who have a weakened or impaired immune system, which may occur as a result of several conditions, which include diabetes, HIV, AIDS, and cancer. And number 6, people who take medicines for esophageal reflux disease known as GERD. Number 7, people who experience malnutrition. Number 8, people who smoke tobacco, consume large amounts of alcohol, or both. Number 9, people who have been exposed to certain chemicals or pollutants. And number 10, people who have been recently hospitalized in an intensive care unit. Now, let's get down to the complications. Pneumonia can cause complications. These are more common among the following groups of people. Number 1, the young children. Number 2, the older adults. And number 3, people with certain pre-existing health conditions. Now, what are the preventions? There are 2 different vaccines to help prevent pneumococcal disease, but the most common bacterial cause of pneumonia. The vaccine protects against a wide variety of pneumococcal infections. While they may not completely protect older adults from pneumonia, they can significantly reduce the risk of pneumonia and other infections caused by S. pneumoniae, including blood and brain infections. Now, there are 2 pneumonia vaccines available. I'll just go ahead now and tell you the 2 types of vaccine for the pneumonia disease that we have currently. Number 1, the Pneumococcal Conjugate vaccine. The Pneumococcal Conjugate vaccine is a pneumococcal vaccine that doctors may refer to as Prevener or PCV13. Doctors recommend PCV13 for the following groups. Number 1, children under 2 years old, as PCV13 is a typical part of an infant routine immunizations. Number 2, those aged 2 years or above who have certain underlying medical conditions. These are the persons who go ahead to take the PCV13. Now, number 2, the Pneumococcal Polysaccharide vaccine. The Pneumococcal Polysaccharide vaccine is a pneumococcal vaccine the doctors may also refer to as Pneumovax or PPSV23. Doctors recommend PPSV23 for the following groups. Number 1, people aged 2 to 64 years who have certain underlying medical conditions such as diabetes, chronic heart, lung, or kidney disease, people who have lack of a spleen due to surgical removal, adults who are aged 19 to 64 years who smoke cigarettes, and all adults ages 65 years or above. Now, there are other preventive measures as well. Along with, vaccinations, doctors recommend the following measures to help prevent pneumonia. Number 1, regular hand washing. Number 2, covering the mouth and nose when coughing or sneezing. Number 3, refraining from smoking. Number 4, eating a balanced, nutritious diet. Number 5, exercising regularly. Number 6, staying away from people who have pneumonia or being extra vigilant about hygiene when around people who are unwell. As we wind down on the program this very beautiful day, I would go for a very quick break. When I come back, we'll begin to take the summary and wind down proceedings on the program. Please do not stray. Now, as we get down to the summary, I need you to know that pneumonia is usually due to an infection. And when we talk about infection, we're talking about bacterial, viral, or fungal infection. People can also develop pneumonia after inhaling contaminated food, water, or saliva into their lungs. This lung condition is more common among young children, older adults, and people with pre-existing medical conditions that affect their organs or weaken their immune systems. These groups also have an increased risk of a serious complication of pneumonia. As such, they should take extra measures to help prevent pneumonia, which may include receiving a pneumococcal vaccine. Whatever the cause of pneumonia, treatment includes getting lots of rest and drinking plenty of fluids. When I talk about fluids, I mean water. A doctor may recommend additional treatment depending on the person's pneumonia type, symptoms, and overall health. People should contact their doctor if their symptoms persist or worsen. And this is where we let down the anchors on today's episode of the Spotlight on Food and Health Communications. I want to believe you've learned a thing or two. Now, the best you can do is to kindly subscribe to this YouTube channel if you haven't subscribed. And if you have subscribed already and you've got value from this very content we've released for you, kindly go ahead and like the video. You could also leave your thoughts, comments, contribution, whatever it is, in the comments section below, and where it applies that we reach out to you, we will go ahead and reach out to you. Till I come your way next time on the program, my name is Victor Waberi. Keep staying healthy.